Good evening, ladies and gentlemen. I'd like to welcome you to the Pitt County Board of Health meeting for November. This time I'd like to call the meeting to order. I'd like to entertain any public comments, and we do not have any tonight. So I'd like to go into the minutes from last week. All those that think you've reviewed your minutes from last week, last month. Need a motion?
So moved.
Motion to approve the minutes from last month? Seconded. Any discussions? All in favor?
Aye.
Minutes from last month are approved. This time, financial report from John Reed.
Thank you, Mr. Chairman, board members. You have the October 31 financials in front of you. I just want to highlight a few changes from previous month's financial report. As you can see in the original budget of $9.88 million, which was adopted back in June of 2011. Since then, we have added about $235,000 to the health department's budget. The largest single piece of that was the $250,000 funding we received from the Department of Public Health for the school nurse funding initiative. That really is a pass-through from the state to the health department and then eventually to the hospital, and they in turn, that funding is part of the funding that is provided for the hospital to fund 5 school nurses within the Pitt County school system. Once you take that addition into account, the budget now is about $10,116,000. The pro rata column on the report is really, since we're 4 months into the year, a third of the way through the year, the pro rata budget is just 1/3 of that current budget. As you can see, the column year-to-date, 31 October 11, that is the column where we record actual receipts coming into the health department, and then down below actual expenditures leaving the health department. And as you can see, if you compare the actual receipts that we've gotten for the 4 months ending October 31 and compare that to the expenditures we've incurred through October 31, we've got a surplus of about $226,000. That is, the revenue has exceeded our expenditures through the first 4 months of the year. It's not quite as rosy as that. As always, there are several revenue items that don't match up with the expenditures. So, and the first one is, and I've added those into the timing column of the report, $145,000 in the Medicaid line. Medicaid receipts are typically received the month after we receive the service. $145,000, however, does include about $100,000, more than $100,000 of receipts that we have not received for August and, I'm sorry, for September and August. Oh, thank you. That funding is in the pipeline. We just hasn't hit our checking account yet, our savings account yet. So that money will be forthcoming. I have taken the liberty of putting in the pro rata share of the Medicaid cost settlement that we expect to receive in the fourth quarter of this year of the $88,825. $107,000 is reimbursements from the state for expenditures that we've incurred in October. We just haven't received the money yet. And then there's a number going in the opposite direction of about $692,000 reduction. In October, the county transferred the full second quarter funding for the health department. So they transferred the funding for October, November, and December. I have merely backed out the November and December portion of that, trying to true it up. And then the $18,400 in other is, again, grantor reimbursements for October expenditures that we haven't received yet. Once you take the timing into account, our surplus of $226,000 goes to a deficit of about $107,000. If you recall, last month, the deficit we were showing was about $52,000. That deficit should continue to increase each month. We may have a few months where it may go down, but at the end of the year, we'll probably be using most of our fund balance to cover up that deficit, and we budgeted about $525,000 of fund balance this year. And Mr. Chairman, board members, I'll be glad to answer or attempt to answer any questions that I can.
Anybody with any questions? Need a motion to approve the financial report as is?
So moved.
Second.
Have a first and second. Any more discussions? All in favor?
Aye.
Motion passed.
Mr. Chairman, I do have two more items just to bring to the board's attention.
Sure.
The county manager has requested a meeting with the department heads and their finance officers to occur sometime prior to Thanksgiving, and that is to lay the groundwork and kind of give us a heads up on what we can expect on the upcoming budget cycle. We don't have a date or a time for that meeting. When we have a date and time and the results of that meeting, we will report it back to this board. One other item, Dr. Morrow and I attended a health directors meeting last Friday in Morehead City. The primary topic of that meeting was to discuss changes in the Medicaid cost settlement process. And they're going through a lot of changes. Some of those changes I think are going to have an effect on how much work we have to do internally to generate the information that the state staff needs to do the Medicaid cost settlement. It's a new process this year for the Medicaid cost settlement, and I think it's a process that's in transition. They are going to emphasize looking at disciplines within our health department and where those disciplines spend their time and the related salary and fringes of those disciplines to give us a different Medicaid cost settlement. From what I can glean from that meeting, I think it's going to require a lot more work from our staff in giving the state staff detailed information about how our staff spend their time and what programs, and also we have to give them a lot of detailed payroll information to kind of coincide with that staff time. The indications we've gotten is that the new process will yield at least the same Medicaid cost settlement amounts as we've received in the past, assuming we've had no structural changes within the department. We do not have a date for the site visit yet. When we get that date, I'll bring it back to the board, and I'll try to keep this board informed as to the process of the Medicaid cost settlement. One thing they did say was that if the process is done correctly, they should be able to give us a fairly accurate number at the exit conference of how much we will receive in the cost settlement. So prior to that, we've been waiting until late June to actually get the money, and we didn't really know what the funding was going to be, what the settlement amount was, until sometimes it was late as May or June. So hopefully we'll have better information for this board earlier in the process. And that will help us also budget for the next year, because most years we predicate next year's Medicaid cost settlement on what we received the prior year. So hopefully the process, even though it's going to take a little bit more time and effort for our staff, it will give this board and the management team at the health department a little better information earlier in the cycle. Thank you, Mr. Chairman.
Thank you, John. Okay, this time we've got some information items. The Community Health Assessment Update. Joe Morgan.
Good evening. As you know, we're charged every 4 years with conducting a community health assessment as part of our consolidated contract with the state. As in years past, the health department is partnering with Pitt Partners for Health, which is our Healthy Carolinians Task Force, and Pitt Memorial Hospital to conduct our county's community health assessment. Tonight, I just want to give you a brief status report on where we are with that. For the past several weeks, we've been combing through the data that's available to us from the State Center for Health Statistics, such as the leading causes of death, the behavior risk factor surveillance survey information that gives us data about percent population with certain chronic conditions like hypertension or diabetes, and behaviors such as smoking or physical inactivity. We've also reviewed the U.S. Census data for our county and other data such as unemployment information that we have. All this information was presented to Pitt Partners for Health at our October meeting. Additionally, we've conducted 9 listening sessions with various groups to identify what key leaders in our community think are the major health concerns, the community assets, barriers, and first steps that are needed to address these priority health issues. This information is being compiled now and will be reported to Pitt Partners for Health at our November meeting, which it happens to be in 2 days, this Thursday at 8:30 at Sycamore Hill Church located on Hooker Road. Pitt Partners for Health does encourage everyone to participate in our meetings, and you can contact Kristen Brooks for people who may be listening now. They can contact Kristen Brooks at Pitt Memorial Hospital to learn more information about how to be involved with Pitt Partners. The hospital contracted with the ECU Survey Research Center to conduct telephone interviews with people within our county. These interviews have been completed, and we're now awaiting the results. Over 350 telephone interviews were conducted through that process. We're also collecting information about our health resources in the county in an effort to identify potential gaps. For example, through the assistance of our planning department and our county parks and recreation, we're identifying where we have parks in the county, throughout the county, in terms of where municipalities may have them. We're looking at where we have grocery stores and other places that provide access to healthy foods. Of course, we're looking at traditional healthcare resources that we all think about in terms of the types of physicians we have, urgent care centers, numbers, where they're located, dentists, that kind of thing. We anticipate that the partnership will vote on priorities at their December 8th meeting, which will be held at Cooperative Extension Center. Following this, we've been asked to present this information to the Pitt Memorial Hospital Foundation as they prepare for their next wave of funding for community grants. They will be looking at potentially redefining what their priorities might be based on the information. And then we'd like to present all of this information to you at your January meeting, and we'll provide that information, some of course in your packet, for you to be able to review that, at which time in January we'd hope that you will be able to select priorities for the next 3 to 4 years. And I say 3 to 4 years, traditionally it's been every 4. We may be shifting that to accommodate new requirements that not-for-profit hospitals have with Affordable Care Act guidance that says that they need to conduct community health assessments every 3 years. So we're working this is the first time that the hospital formally has had to go through this process, though they've been a partner with us for the last 15 years in conducting community health assessments. I want to extend a special thank you to Heather Gaucher. We have a MPH student from ECU, a Master's in Public Health student from ECU, who's been helping us to compile much of this data. So we have a lot of information coming to you over the next couple of months.
Okay.
Questions? Okay, thank you.
Thank you. Next on our information, the Triple P Positive Parenting Program.
And Mr. Chairman, that's my item.
Sure.
We've talked a little bit about Triple P in the past. This is a grant positive parenting program. This program was started in New Zealand, Australia, I believe, originally, but it's come to America and is spread around parts of America. We were fortunate enough to be one of 2 health departments in the country that received a grant from NACCHO, the National Association of County and City Health Officials, for the Triple P program. And this is in collaboration with our local federally qualified health center, the Bernstein Center, which is just north of our health department, actually just north of the river. So we're very excited. We received the grant, got notified a couple of months ago actually about receiving the grant. We've yesterday the county commissioners approved the acceptance of this grant, the funding for it. So this is going to be totally grant funded, no county dollars involved, but it'll be working with private providers, our health centers, the health department, the federally qualified health center, the medical school, child care centers, and also have a broad media component that will be in addition to the budget that we'll have, as I understand. We are advertising for positions. There'll be a full-time project coordinator position and a quarter-time media coordinator position involved with this grant. So we've started advertising today for those positions, and hope to have someone on board quickly. They're planning a site visit from the national office sometime between Thanksgiving and Christmas. So a lot's going to happen, I think, pretty fast. We've got $110,000 in grant funding that runs through December the 31st of this year. I don't think there's any way we're going to spend that much money that soon. But fortunately, we anticipate that they're going to roll that unspent funding at the end of this calendar year into probably next year's funding. So I think that will work well for our budget too. So just wanted to bring you up to date on what's going on with Triple P. We're very, very excited about the opportunity.
How long do you think that grant will?
Oh, I'm sorry, it's a 3-year grant.
3-year grant?
Run through December 31st of 2013.
Thank you.
And possibly some extension. I should mention too, the state is also looking at the Triple P program, sort of like the Nurse Family Partnership program that we started a couple of years ago. It's become a model for the state to adopt. So that may indeed happen for North Carolina, and if so, we would anticipate that the state would start providing some of that funding to carry us on forward after 2013.
Dr. Morrow, what kinds of services will be provided by that grant?
Yeah, it's a multi-level, it's evidence-based, it's multi-level. There are 5 levels. The first level is all about media-based parent education information that would be broad, positive messages about parenting through media. The second level is called Selected Triple P, and that's parents with specific concerns about children's behavior or their child's development. Third level is more intensive, where you have more counseling involved with it. The fourth letter are there are actually different parts of that even, so it's broken down even further between these levels. But it's parents that want intensive training in positive parenting skills, parents of more severe behavior problems such as aggressive or oppositional behavior disorders, that type of thing. And then level 5 would be folks who have already have dysfunctional families or have child abuse situations already going on. So it's very intensive. So it's a really broad array of services. So we're going to be working with Smart Start, who does the sort of quality assurance for the child care centers in the community, as well as many other things, and also with Department of Social Services, who of course is dealing with a lot of these child abuse situations.
Thank you.
Any more questions? Okay, next information, quality improvement. Terry Wilson.
Good evening. Good evening. Thank you for letting me talk to you about quality improvement. Let me just get just a minute, get my... Okay. I want to talk to you tonight about quality improvement and some of the concepts with lean improvement principles, and to tell you some about the improvements that we've made in some of our programs at the Health Department. A group of staff attended training with the North Carolina Center for Public Health Quality. And the project ended technically in August, but of course our work is going on and will continue. So just to talk to you a little bit about the lean improvements, to implement quality improvement in our programs, the first thing we do is select a project. The project we did select was our appointment system. We assemble a team, and then we develop an aim statement with goals. The goals for our appointment system was that we wanted to provide clients' appointments when they call in on our appointment line. We want to give them an appointment the first time they call, and hopefully let the phone call be less than 10 minutes. And we wanted to make changes to our system while maintaining our show rates, hopefully even if we could improve our show rates, as well as maintain our customer satisfaction. So after we developed our aim statement, then we moved to developing measures, and we want to put measures in place because when we're making changes, we want to make sure that our changes are going to be positive and that they're going to actually improve, because not all change is improvement. And then once we identify these measures, we identify change ideas. What can we do differently? And then we want to test these changes, and we always test our changes on a small scale using the PDSA cycle, and we'll be talking about that in just a few minutes too. And then when our changes are in place and they're positive changes, we want to make sure that they spread, that they sustain, that our changes are sustained, and that also we can spread these improvements to other areas in the health department. We also have a Quality Improvement Council. It's a group of individuals that are some in leadership positions, and some are frontline staff, and some are members of our management team. We meet monthly, and we recommend our projects, and we recommend our projects to the management team, who will then review the projects and help us prioritize. We assemble our QI teams, and it's very important that when we do assemble a team, that it's going to be people that are actually working in that area, as well as some people that work indirectly. But mainly we want to talk to and involve the people that are actually doing the work. Another function of our Quality Improvement Council is that we review the progress of our quality improvement teams, and they're coached, or they will use me as a resource. I'm the Quality Improvement Coordinator, so I will be working very closely with these QI teams. And then we communicate and celebrate their successes, because it's very motivating to staff when we make a change, we're seeing improvement, and their ideas work, and it's very motivating for staff. So we want to keep that excitement and motivation going. So what can we do? What ideas or what changes can we make? And the very first step that we need to do is to understand the current process. And one of the concepts of lean improvement is what we call a Gemba walk, which is actually going to the area and watching the work be done by the people, and actually talking to the people who are actually doing the work. So that is very important, because you would be amazed that when you think a process is going a certain way or a task is being done a certain way, and when you actually go there and look and watch it being done, you may see that a step in the process has been omitted or even added or altered in some way. So it's very important to actually go to the area, watch the work being done, and talk to the people that are actually doing the work. Other means of identifying opportunities for improvement is understanding value and waste. And this is from the customer's perspective. It is not from staff perspective, but what can we do to improve things for our customers? We're looking at what is value added. An example of value added would be maybe the service we provide. Non-value added but necessary, that would be something that maybe the customer doesn't see as value, but maybe it could be a program mandate for us, and we still have to keep that process or that particular function in the process. And non-value added, an example of non-value added would be, say, waiting time for a patient, that they have to wait for their services. When we're doing the Gemba walk, we also look for waste, and there's an acronym which is known as downtime. It's 8 signs of waste, which include defects, overproduction, which is repeating steps, waiting time, non-value added, transportation. And transportation literally means, where do we have to go to gather our supplies? Where does the patient have to go? Does the patient have to get up and sit down very many times? That's something that we might want to look at when we're looking at our process. Inventory, is it, do we have certain levels of inventory that we keep running short and have to restock? Motion, is our actual work environment set up in a way that's conducive to help us obtain the things we need pretty quickly. And employees, E for employees. And that is making sure that we are utilizing our employees at their maximum potential. An example of that is we looked at some of the tasks being done by paid employees, say putting together packets. That would be something that we could utilize a student volunteer for. So we kind of look at those functions, and then that would free that staff person up to go do something else that would be important in their job. When we're looking at opportunities for improvement, it's very important to look at the root cause. We ask 5 levels of why. Why do we need to do something a certain way? Why is it being done this way? We ask 5 levels of why, and an analogy of this would be like an onion. Every time you ask why, you're peeling a layer of the onion to get to the root cause of why something is occurring. And then we also look at the physical environment, making sure that things are sorted, set up, standardized. We want to get rid of equipment that doesn't work, get it out of the way so to make room for what does. So it's important to look at our physical environment. And a system that Lean Improvement refers to is the 5S system, which is sort, set, and order, shine, standardize, and sustain. This is a picture that we took of our Kaizen event. And a Kaizen event is where you take about 4 days, 3 or 4 days, even less than that if it's not a big project, but you actually take apart and put back together. The word Kaizen means to take apart and put back together. So you see the flip charts, the post-it notes, and then you see the different color post-it notes. That's where we actually did what we call value stream mapping. We took the appointment system and took it piece by piece and discussed it, and took a mock patient scenario, went from the very beginning of the phone call until that patient came in for services, and took it apart to see what we could do differently. And you can see with the different, you see some yellow stars and some pink paper and orange paper. All of these were change ideas that came in our discussions. So during our Kaizen event, we discussed ideas for change. Then we test our ideas for change, and it's important that 2 things I would like to mention when we're talking about our processes. Number 1, we focus on the process and not individual employees. This is not about individual employee performance. It's about our process. And the other thing is we always do our test on a small scale. So we plan our testing, we plan our changes that we want to make, and we also, in the very beginning, we plan how we're going to measure it, because like we said, not all change is improvement. So we want to make sure that the things we do change are going to be actual improvements. We carry out the change, we study the change, and then after we study the data that we've collected, and I'll show some examples of that, we want to act on it. And there's 3 decisions to make. If it's a good change, things are working well, we love it, we're going to adopt it. If things worked well but it needs some tweaking, then we're going to adapt it. And if things are worse, we don't like it at all, we're going to abandon it. So after we've made those decisions, the cycle starts all over again. This is an example of how we measure our successes. This is what we call a run chart, and this is actually putting in data where we collected data every day, which turned into weekly data and then monthly data on our Clinic A Express. When we did our Kaizen event, and even though the focus was on our appointment system, going back to root cause, the reason why some of our patients could not get appointment for services is when they would call to get an appointment, we would be booked up already. So we had to make room in our clinic system to serve the patients and the types of services that they needed. So what we did was we moved some of our asymptomatic STD clients and developed another clinic called Clinic A Express, which is specifically for clients that are looking for STD screening, HIV screening, hepatitis C, and syphilis screening. We moved them over to a separate clinic, and the nurse that works this clinic could tell a difference that on Mondays she had a low show rate on Mondays, but she had a very high show rate on Friday. So she mentioned this to her supervisor. So what we did was we canceled the clinic on Mondays and moved that nurse to another area to work on Mondays. And then we doubled the number of appointments on Fridays. And as you can see, we did that about the first week in October, and the show rate went from about 78% to 97%. And this is also an example of the importance of involving the staff that are actually working in those areas. And just another thing to mention too, during our Kaizen event, we made changes in our STD clinic, and the first month we had a 13% increase in our show rate. And we were able to see about 96 additional exams the first 6 weeks after our Kaizen event. So, that was improvements that were worth sustaining. Our second Kaizen event that we conducted at the health department was with our breast and cervical cancer control program. And we did very much the same thing. We did the value stream mapping and the Post-it notes all over the wall. And these are some of the changes that came about during that Kaizen event, where we moved our Medicaid information is collected now at the registration process. We made revisions to letters communicating with the clients. We made improvements to the referral follow-up system. We streamlined staff duties because we could see some similarities in tasks being done by staff or some duplication, so we streamlined that. We provided a standardized provider payment procedure, and we set up a tracking spreadsheet that tracks how much money is being spent on each patient, so that we don't go over those amounts and that we could stay within the guidelines of the grant. And this is just an additional thought. This is from W. Edwards Deming, who is a leader in quality improvement, and that quality is everyone's responsibility. Is there any questions? All right.
No, thank you.
Thank you very much.
Thank you, Terry.
I'd just like to say, I think Terry's done an outstanding job. She is really the lead person for our whole agency in quality improvement. And although she's a nurse by training, she's stepped into this role and continues to do nursing duties, but she has stepped into this role really very well and is addressing issues like this across all 5 of our divisions. And she's really done a super job. I think, key to this is what she just showed you with our Clinic A experience, the no-shows, and anybody that's worked in clinics knows that no-shows is really just a killer. And so being able to have 97% show rate in any clinic is absolutely great. But the more we can do to improve that the show rate or decrease the no-show rate, it really helps save resources and use our tax dollars wisely. So we really are thankful for all of her efforts and the other staff that have participated in these quality improvement projects. Thank you, Terry.
Okay, next I have a diabetes self-management program update. Robin, and you got a partner?
Yes.
Stephanie.
Good evening, everyone. My name is Robin High, and this is Stephanie Hart, and we are here on behalf of all of our team, which is the Diabetes Education Self-Management team at the Health Department. With that team, we have Jackie Sugg, we have Liz Steele, and we also have Jenny Kraft. Let's see. Okay. We're going to give you a few updates this evening about National Diabetes Month, as well as our self-management program that we've talked to you about in the past. November is National Diabetes Month, and every year the National Diabetes Program Association creates a theme that educates the public about diabetes and how to prevent it. This year the theme is I Raise My Hand to Stop Diabetes. As a community, this gives us a really good opportunity to help people learn more about diabetes and again how to control and prevent it. There are several types of diabetes, including type 1, type 2, gestational, and prediabetes. However, type 2 diabetes accounts for about 90% of all diagnosed cases that we have. Type 2 has been more commonly associated with adults in the past, but what we're seeing more commonly now is that children and adolescents are also getting diabetes in relation to obesity rates in the county. In fact, while we don't have Pitt specific data, we do know that over 1/3 of individuals in eastern North Carolina were told that they had diabetes between 30 and 50 years old. So again, you can see how the trend changes here. Some other statistics that we came up with that we researched was that diabetes is the 6th leading cause of death in Pitt County, and a little over 7% of Pitt County adults report being told that they have diabetes. However, this may be an underreported number. Some more statistics that we looked at was being overweight is the leading risk factor for developing type 2 diabetes. Over 60% of adults in Pitt County report being overweight or obese. And about 1 in 3 children in Pitt County is obese or overweight. While there are other factors that increase your risk, such as age, family history, race, your lifestyle plays a very, very important role in that as well. And we'll be talking about more of those initiatives that we do with our education program in just a few moments. In terms of what type of education occurs, we also gathered some information about that with diabetes. Only half of people in North Carolina diagnosed with diabetes have taken a course or class on managing their diabetes. And diabetes self-management education is effective for improving clinical outcomes and quality of life for people who have diabetes. Before we move on to the updates for our diabetes programs and additions to our programs that we've had over the year, we'd like to pay thanks to Kate B. Reynolds Trust Fund for providing the startup funds to the North Carolina Department of Public Health Diabetes Prevention and Control Program. And locally, we'd also like to thank the Pitt Memorial Hospital Foundation, which has provided us the opportunity to have a registered dietitian and also to provide educational incentives for the people that we're serving.
Good evening. I'm going to begin to talk about our diabetes self-management program, starting with the goals. I'd like to point out some of those for you. Some of the main goals of the diabetes self-management program are to assist primary care providers in the management of diabetic patients. Oftentimes, a lot of the providers have very busy practices, and so it's hard for them to provide intensive counseling on such topics as nutrition. So we do assist primary care providers in doing that. We also increase knowledge on how to effectively self-manage diabetes, help prevent both acute and chronic complications related to diabetes, and increase awareness of diabetes in the community. The Diabetes Self-Management Education Program, it includes one-on-one counseling and also group education sessions. So the first visit entails meeting with a one-on-one visit with a dietitian or a registered nurse, and the second and third visits are group education visits in a classroom setting, and the follow-up visits at 3 months and 1 year are also in the group setting. In order to become enrolled, if you're interested, or if a provider is interested in enrolling their patient, the patient has to be diagnosed with diabetes, pre-diabetes, or gestational diabetes, and then the provider will complete a referral form and fax it to us in our confidential fax at the health department. It is required that a recent hemoglobin A1C be provided with that referral, and then our office, one of the team members for the Diabetes Self-Management Program will contact the patient to set up the initial consult. Topics that are included in the Diabetes Self-Management group education classes are the following: nutrition principles, medications, physical activity, the complications, and how to prevent those complications, goal setting being also very important, and stress management. The classes, what they include, trained professionals, so both a registered dietitian and a registered nurse work together at each group education session and help the patient set goals every time they come in order to better manage diabetes. The class times do total 8 hours of group education, so the first session is 4 hours and the second session is an additional 4 hours. Each patient is provided with diabetes education materials. They receive workbooks and other incentives, such as the following cookbooks, resistance bands. They receive pedometers. We do offer a healthy lunch or healthy snacks, samples and recipes. And we also encourage the patients to bring their families, friends, significant others, or maybe their diabetes social support system with them along to the class and attend with them. Just to also give you a little bit of information about our successes. Since 2008, we've provided over 330 contacts. Contacts can include anything from an initial visit, face-to-face, a support phone call, follow-up visits, and also educational classes. Since September 2010, we have increased participation by approximately 42%, and referrals have increased by almost half. Pitt County Health Department is recognized by the American Diabetes Association to offer diabetes self-management education program to individuals with diabetes. And just this past year, we were recognized as an American Diabetes Association Provider of the Year. New to this year, which we're very happy about, we do offer a monthly diabetes support group. It is free and open to anyone in the community. It's offered on the second Wednesdays of each month. And here at the Pitt County Health Department, it includes diabetes topics, discussions. We do have cooking demonstrations each time, and we provide light refreshments each time as well. We'd also like to mention to you tomorrow, in fact, from 10 to 12, we, in honor of November being National Diabetes Awareness Month, we have our Diabetes Awareness Open House at the Pitt County Health Department. It is a free event for people who are just interested in learning more about diabetes control, your risk for diabetes, and preventing diabetes. We will be featuring many different things, interactive educational booths. We will have a cooking demonstration and exercise demonstration, also giving people information about community resources and providing refreshments. So we'd like to invite all of you, of course, there to our Diabetes Awareness Open House, and we welcome any questions that you might have.
Thank you. Thank you for the update. Okay, at this time, we have some new business. I think Dr. Morrow.
Thank you, Mr. Chairman. As y'all recall, at the October 11th Board of Health meeting, I reported that an appeal from Pastimes Billiards and Pub had not been received within the 30-day time period from issuance of their third notice of violation. That notice of violation went out on August the 17th, and the 30-day time period expired on September the 16th. On the following day after the Board of Health meeting on October 12th, office staff from the attorney for the Pastimes Bar hand-delivered to the Health Department and to the county attorney a copy of a notice of appeal dated August the 31st. Neither the Health Department or the county attorney have any record of receiving this notice prior to October the 12th. I immediately contacted and consulted with our chairman, Mr. Ogden, on October 12th, and also with the State Division of Public Health Attorney, Ella V. Donahue, and her advice was that in order to maintain consistency with other Board of Health appeals, that we should request evidence that this notice was actually served by the bar's attorney in a timely fashion. A letter requesting this evidence was sent last week by our county attorneys, and this letter explained that the Board of Health would be willing tonight to review this evidence and consider proceeding with an appeal hearing. In the meantime, I have returned to Pastimes Pub just a few weeks ago on October the 21st and verified that they continue to be non-compliant with the state law. The fines against them are accumulating at $200 per day, and their current total is at $16,200. I would like to remind our public that these fines, when collected, do not come back to our health department, but rather will go to our public schools. It seems clear to me that Pastimes does not wish to or intend to comply with the state law. According to legal counsel, if this board decides not to hear the appeal tonight, no action is necessary. The attorney, Mr. Jonathan Bridgers, is here tonight to present the evidence that he has in relation to this.
Mr. Bridgers?
Good evening.
Good evening.
How many board members are there present?
Eight.
8. Can I start at one end and just have it passed down?
Sure.
That's sufficient.
I'll help you with that.
Mr. Chairman or Vice Chairman?
Vice Chairman.
I also have a time-stamped text message from the date in question, August 31st at 2:11 p.m. But I can show it. How do you want that to be received?
I guess you can pass it and let it, or just walk and let us view it.
Is at the bottom? Right there. Okay.
Mr. Bridgers, are you ready?
Yes, sir.
Okay.
As you see from the affidavits, on August the 26th of this year, I was involved in a motorcycle accident, which kept me in the ICU unit for 10 days at Pitt Memorial Hospital. On the 30th of August, individuals from Nelson Owens and Dupree, the firm that I work for, came to the hospital to discuss my caseload due to the fact that I didn't know when I was going to be able to come back to work. At that time, I notified Mr. Owens III and Jeffrey Blick that there was an appeal pending in the pastime smoking case, and that I needed some staff member from the office to come so I could explain what needed to be done. Later that day, they sent 2 staff members, one Robin Golden, the other Patty Valentine, at which time I explained that there needed to be a letter sent to Dr. Morrow explaining that, 1, that we represented Pastimes Billiards, and 2, that that we were appealing the violations. I stated that we had done previous letters, as this board is aware of, and that there was a form letter that just needed the names and everything changed. On the 31st of August, I was sent a text message telling me that the Pastimes appeal was ready for review, at which time I spoke with Ms. Valentine and asked her to get Mr. Blick to sign on my behalf, since I was in the hospital and didn't think it was appropriate for me to sign it, and I wanted another attorney to review it. And at that point, the rest of the affidavits, I believe, pick up what happened after that.
Can we ask a question?
Sure.
When you sent this letter out, how do y'all normally send your mail? Registered, sign, return, anything?
Just regular mail. Mr. Owens III stated that he had taken the mail that day to have it deposited because of the fact that it was an appeal. And
On the 31st?
yes, ma'am, per his affidavit. And if you'll note, the first sheet that I gave you gives you the document number of the appeal, and that it was saved on August 31st at 1:57 p.m.
Do you have a copy of that?
Yes, ma'am.
Of the letter that you sent stating you wanted to appeal?
Yes, ma'am.
Dr. Moore, in the past, when y'all receive any communications, is it dated, time, stamp, anything noticing when you receive something?
Yeah, all of our mail is stamped. As you can see, this was what we received October the 14th from Mr. Bridger's office, and it's stamped with a time stamp, or date stamp, I should say, like this on the envelope. And then these were the pages that were also stamped received. So a previous, I think I have a previous appeal that was sent from his office. This was April the 8th on another case that he did. If you want to compare that, but it's stamped the date that we received it.
Is this an exact copy of the appeal?
Yes, ma'am.
Did you send it out with any letterhead, like this one?
I didn't send it out. I was at the hospital.
Well, whoever from your office that sent it out, was it sent without a letterhead? If that's an exact copy versus this letterhead?
I don't know. I wasn't there.
Well, if that's an exact copy, I guess it didn't have a letterhead.
Then yes, that would be correct.
Okay.
Any other,
That's
any other items that you want to mention, or this is it?
That's it.
Okay.
I
Any
just
questions?
find it
Well,
odd that.
first of all, is there Is there a motion to consider this appeal from what you have right here? No motion? Okay. It's closed.
No
We have no action and nobody's. Thank you, Mr. Bridger. At this time, Health Director has a report.
Just several things to share with you. I wanted to mention the Public Health Task Force. The Health Directors Association formed a Public Health Task Force, and they met September the 22nd and 23rd in Charlotte in coordination with the 100th year celebration of the North Carolina Public Health Association. The task force was made up of 28 local and state public health experts. Mr. Bob Blackburn represented the North Carolina Association of Local Boards of Health. I was also a member of the task force, and you have a copy of the executive summary. I've also forwarded to you, emailed you a copy of the complete draft report. And I would like for all of y'all to review that draft and give your input to me or to the Mr. Blackburn through the Boards of Health Association if you'd rather speak with him. And they'd like to get that input back by the end of this month if possible. The goal of the task force is to help shape and influence the changes that are coming to public health and create a stronger alignment and collaboration between state and local public health. So we're looking forward to the input on that. We're getting a lot of input from various stakeholders across the state, including boards of health. A lot of the discussion during the task force related to the actions by the General Assembly this year that dealt with some questions about consolidation versus regionalization of public health departments. And we really are still not sure exactly where that's going to go when the General Assembly comes back into session. But the bill is still out there, so we'll see. I also just wanted to mention that this Monday, November the 14th at 5:30, the public health grand rounds at ECU Brody School of Medicine auditorium is going to present Mr. Gene Matthews. Gene Matthews is an attorney with the Public Health Law Network and the North Carolina Institute for Public Health in Chapel Hill. He used to be an attorney for the CDC, and he also participated in our task force meeting in September and presented on a similar topic that he's presenting on Monday, which is the title of his topic is Public Health in the Kill Zone, Restructuring of Local Public Health Agencies. So I think you'll find it very interesting discussion if you can make that 5:30 p.m. Monday. Also just wanted to mention that every year the East Central Dental Society sponsors Give Kids a Smile Day for children who don't have access to a dentist. And nearly all of the dentists here in Pitt County have given their time and office resources to help these children with dental disease. This year it will be on February the 3rd of 2012. Unfortunately, due to budget cuts we had this year, there will no longer be, we no longer have the assistance of a public health dental hygienist who's been going into the schools identifying a lot of these children and arranging for them to make it to Give Kids a Smile. So we are, the Dental Society is asking for the public's help in finding these needy children and helping them get to the dentist on February 3rd for this free care. So the parent of the child will also need to accompany them on that day. We're going to have more information about who to call and to arrange and how to arrange this, but we don't have that information for you tonight. But look for some public service announcements over the next coming months in relation to Give Kids a Smile Day, and we hope that we can really have a good turnout. It was not as good a turnout as historically they've had this past year. A lot, again, dealing with not having that system in place with the dental hygienist that identified these children. So we're trying to come up with some new ideas about how we can get those kids taken care of. And we'll of course, use our staff from our mobile dental unit that goes to the elementary schools to help with that effort also. And lastly, I just wanted to mention the flu. We're not seeing any evidence of influenza yet, but we are anticipating that typically we'll start seeing it in sometimes as early as December, typically in later January, February. But I was on conversation or telephone today with the state epidemiology branch. They're getting some sporadic reports of rapid tests in doctors' offices, but nothing from the state lab yet has been identified as influenza. So that's good news. So, but we do have a influenza video that was just produced, and we've got just a couple of minutes. I'd like to show that to you if they can run that.
The flu is a contagious respiratory illness caused by influenza viruses that can infect the throat, the nose, and the lungs. It often presents with cough, sometimes fever, and in many patients they'll have body aches. Flu can cause mild to severe illness and can even lead to death.
Flu seasons are unpredictable and can be severe. In some years, up to 50,000 people have died from the flu.
Flu viruses spread mainly by droplets made when people with flu cough, sneeze, or talk. These droplets can land in the mouths or noses of people who are nearby and make them sick.
The single best way to prevent the flu is by getting a flu vaccine each year. Annual flu vaccination usually begins in September or as soon as vaccine is available. Most years seasonal flu activity peaks in January, February, or later, though in some years it has peaked as early as October. That's why it's important to get your vaccine today if you haven't already.
I get the flu shot to protect my health because I can't afford to miss work because I'm sick.
I get a flu shot every year to protect myself and my patients.
By protecting myself with the flu shot, I also protect my baby.
I get my flu shot to protect myself and my son.
I am getting my flu shot today because I am at high risk of complications from the flu and I do not want to get sick.
I'm getting my flu shot because working with the public, I need to make sure that I'm safe.
La vacuna de la influencia es muy importante para proteger a usted y a su familia.
All of our staff have received the flu vaccine to protect ourselves and our patients.
We wanted to thank the Public Information Office for their production of that. They really did a great job, I think. So thank Kara Jones and her staff for that. And lastly, I just mentioned a lot of folks have been reading about the E. coli outbreak associated with the State Fair in Raleigh. I was on the phone today again with the epidemiologist. The study of that is pretty much complete. They're analyzing the data right now, and we hope that we'll have some results later this week or first part of next week in relation to what may have caused that outbreak. But so far there's 28 cases, confirmed cases. Still got some folks in the hospital, but I understand that they are getting better, so it's not near as bad as it may have been. So we want our hats off to Wake County Health Department for picking up on that outbreak early and instituting some surveillance that help identify those patients early. That's all I have.
Thank you. I'd like to thank all the presenters tonight. Y'all did a great job, health department staff. And I need a motion to adjourn the meeting.
So moved. Second.
All in favor? Aye. Thank you.